Okay, welcome. My name's Professor Nora Colton. We're going to get started in just a moment. We're just waiting for everyone to enter. Okay, so welcome to our webinar. I'm really happy to have the opportunity to present to you our Global Healthcare Management Master's Program. So I am going to share my slides and take you through a presentation. This is being recorded. You'll note that your chat function and hand function do not work, but you have a Q&A button there at the bottom of your screen. And at any point, you can put a question in, and then at the end, I'll address all your questions. So again, thank you so much for joining us. We're really excited to have you here and to share with you this really exciting program. So let me just get my presentation up. Give me 1 second. Okay, so hopefully you can see my screen. I'm just going to put this on full screen and we'll get going. One second. Okay. So again, this is the Global Business School for Health. We are a department that sits in the Faculty of Population Health, and we really operate at the intersection between business and management and healthcare. This is really one of our most exciting programs, our MSc in Global Healthcare Management with roots. And I'm going to take you through and talk to you about this today, and also why it's such an exceptional program. It's really the only kind like it in universities that I know of currently in the UK. So first of all, before I get going, I just want to talk to you a little more about the school, because we are the first business school in the world totally dedicated to educating the next generation of health and healthcare managers in a business school context. We are a business school, and so the approach that we take will really be a management and leadership approach rather than just a health science approach. And I think it's really timely now. As we know, the health sector is growing at an exponential rate. In countries like the United States, it absorbs 18% of their GDP. In most European countries, it's over 10%. What are the factors that are really causing that? Well, mainly we see we've got aging populations, and even places like the Middle East, where they have historically had a very youthful population, they're now aging very quickly. So as people age, they need more health and health care. Also, I think particularly with the pandemic, we're all much more aware of our health, and consumer expectations have really pivoted. People want to understand their health. They seek health care earlier. They understand, what's available. People are more educated about their health. So all of these things, combined with the fact that there are lifestyles, much of us work, in front of computers, and our lifestyles are not as healthy as they should be. Our diets are not as healthy. That leads to lots of non-communicable diseases. So things that like cardiac, diabetes. We see growing. We see lots of people who are dealing with chronic disease for much longer throughout their life. So the emphasis on healthcare couldn't be more important and more timely. The other thing is, we have always, as humans, focused on therapies and treating health and illness. Now we're getting to a period where we realize we've got to go upstream and not focus on those downstream services, but on prevention and diagnostics. So the role for people who are managers, who are leaders, who are able to use analytics, who are shaping healthcare and the pathways and the services are so important. We often focus on the need for clinicians, and absolutely the human element of care will always be very important. But we're seeing now a whole new kind of approach, and that requires lots of new players in that health ecosystem. Pharmaceutical companies, biotech companies are changing. They're changing the way they're doing it. The kinds of people they hire are very different. We see big tech coming into healthcare. We see retail coming into healthcare. So it really couldn't be a more exciting time to come to the Global Business School for Health. I can assure you, we've got lots of employer engagement that I'll talk to you about in a minute. And that is because the demand for people in this sector and those people who understand it and who can be the managers and leaders outstrips the supply of people on the job market right now. So it's a great opportunity for you. This couldn't be a better program to undertake if you're interested, if you're moving into this sector. We have a lot of students in our cohort for this year. They don't have a health background. They have a business management background, but they recognize how important getting a master's that gives them that health and healthcare knowledge will be to really coming into this very, very exciting industry. So what do we hope to achieve? Well, we really want to make sure that if you come onto this program, you understand that contemporary healthcare landscape that I've just articulated to you, but really from a leadership and management standpoint, because as I've said, the health ecosystem is widening. There are many more players. The idea that it was either public health or, clinical kinds of routes, that has changed tremendously. So one of the things that we do in this department is we really erase those silos. This is an interdisciplinary department. We have people from lots of different backgrounds who really focus on that business and management context. So you'll learn the theories, the principles and practices of healthcare management. You'll also get it much more from a global lens. So most of our experts, our academics, they come from all over the world. We've done that on purpose because we recognize that health systems can differ tremendously. They differ mainly on things like, how people pay. There's a bit of a spread between market systems and then much more public system. We want to be able to educate you about that whole continuum and give you that kind of comparative approach. To do that, we went out across the globe to recruit some of the best people in the sector to be your instructors. We also place a lot of value on practitioners. So you'll have people who are not just academics teaching you, you'll have practitioners, people who come from some of the leading consultancy firms will also be instructing you. So the idea is really to give you not just the theories and principles of practice from a management standpoint, but also understanding things like quality improvement, patient safety, and really managing a diverse workforce. So the other thing that's so exciting about this program and very unique is that you can pick a route. What do we mean by that? So you'll get core modules that everyone on the Global Healthcare Management program takes. And then you'll get a set of modules that are very specific to a topic. So we've got 3 routes. One is analytics, one is health finance, and one is health leadership. So when you apply, you have to apply to one of those routes. So you will take every term, and I'll talk about that in just a minute. You'll take every term, some of those core modules and some of those specialized modules. Now, in terms of the requirement to coming on to this program, and I want to mention, apply early. One of the reasons we're doing these sessions early on is this is a very competitive program. It's a rolling admissions, and we'll have different points in which we review applicants. So the earlier you get in and you apply to this program, it will help improve your chances of actually getting a place on the program. Now, you have to have a 2-1 or above in terms of your marks or grade classification, and depending on what education system you come from and how that then converts over to the UK. But if you don't quite have that 2-1, but you've got extensive relevant work experience that our academics feel makes you ideal for this course, you can still be considered. You do have to pass the IELTS, and we have the 6.5 overall with 6.0 in all the subtests. Then the other 2 things, and I want to just take a moment these because we take them very serious in the Global Business School for Health. That's your personal statement and your reference. On your personal statement, you need to have a really compelling story. You don't need to have ever studied health before, but we need to understand why you want to do this program now and what you're hoping to achieve through it. So it's very important to take some time, really think about those questions when writing your personal statement. Then I'd like to also say to you, the reference, find someone who actually knows you and also understands the program you're applying for. I see lots of references that are very general. I can quickly realize that the person who wrote that doesn't really know the candidate, or I get somebody who's applying to, say, some finance programs, and then they put an application in for the Global Business School for Health finance route, but the reference doesn't realize that. So they send a reference that's mainly geared up for going into the finance sector, not going into finance in relationship to health. It doesn't mention their aspirations. So again, it doesn't come across authentic, and it would weaken your chance. So when you decide who's going to write your reference, make sure they understand your logic, send them your CV, send them your personal statement, and make sure they know what program you're applying for and why. So who is this program for? Well, as I've already articulated, it's ideal for people who want to be managers, leaders, change makers in the health setting. There's lots of employment routes. You can go into consulting from this program. You can work in, tertiary care in a hospital, on a senior management team, in a manager role. You can also work in public health. You can work in the private sector. You can work in a startup. There's so many companies now that, private companies that work and are related to the health sector. So your opportunities are really wide. And one of the things that we'll do, we have a big emphasis in this school on careers. We really measure our success on your success. So from the very beginning, every single Wednesday, you'll have opportunities to attend career events. You'll have people coming into your modules, giving you lots of information, talking to you, getting to know you. You'll have receptions, network events. You're going to be really busy. And in that process, you'll be building up your social capital to help you really hone in on your career. And hopefully halfway through this program by January, I would expect you to have at least had one offer. So how does the program work? Well, first of all, we have a 1-week induction program, and we're really excited. Next week, we're launching our induction program. We've got, again, some not just telling the students about the programs. We've got some really exciting events. We've got, the global chair of healthcare for KPMG addressing our students. We have one of the most well-known, longest-serving ministers of health. He's a former minister of health. He's also a member of parliament here in the UK addressing our students. Both of them have written books and are authorities on health and healthcare. And those will include a reception with lots of people from industry who are coming, who are supporting our students and our programs. So that's just a little taste of what our students will have throughout their program in the Global Business School for Health. Also, our students, before they've arrived, they've all had the opportunity to take a online self-paced course. It's a fun course on global health systems, just so they can get a taste of what it's going to be like to be in the Global Business School for Health. So once you finish your induction week, you'll start with term 1. And as I've already mentioned to you, you'll take 2 courses that'll be part of your core. In that first semester, you'll take a course that's on kind of economics and finance of health. And then you'll also have a module on management leadership. And then you'll take 2 of the 4 modules you're going to take in your specialism. So if you're doing the finance route, for example, you'll have, I believe it's risk management, accounting, and financial reporting for healthcare. If you're on the leadership route, you'll have a module on power and politics in healthcare, as well as strategic leadership in healthcare, which I teach. And then there's also the analytic route, where you'll also get 2 courses in the area of analytics and machine learning in terms of healthcare. And then in term 2, you'll get a further 2 modules and 2 in your specialism. What I want to really focus on are the 2 kind of capstone projects that you undertake on this program. One's a business project. It's about coming up with a health improvement idea. You'll work in a team with your colleagues. It'll start at the beginning of the year. You'll work across the year. You'll have a number of workshops to really prepare you for that. You'll come up with a concept, and you will have the opportunity then to turn that into a business plan and a pitch, and that will be your output for that module. You'll also have opportunities to have lots of interaction with industry and consultants who will talk to you just about how to frame, how to put together, do the feasibility on such a project. So it's a great opportunity, very hands-on. You'll also have the opportunity to pick an individual topic and do a research project paper. It's a desk-based research project, but you'll have lots of opportunities to really interact and think very specific about something within this wider healthcare management area. So those projects are really important, and they'll give you a context to talk with professionals, people in careers and areas that you hope to go into. The other thing is, I want to just mention, we are in the process of adding some more scholarships, and those will be up on our website. There's also lots of other scholarships you can apply to across UCL. But I just want to highlight one today that we're particularly proud of, and that's our Women Healthcare Leaders Scholarship. Females are very, big in healthcare. They make up the majority of the workforce. In many countries, they make up to 80% of the workforce. And yet, if we look at senior leaders in healthcare, they make up less than 20%. So one of the things that we're doing at the Global Business School for Health is we've got a scholarship. It's £5,000 off your tuition. But more importantly, you'll have a series of workshops. You'll have a mentor. You'll get a lot of extra kind of training and development. And that's with the intention of helping you really break down that barrier and get into a senior role in a healthcare setting. As I mentioned, that's just one scholarship offered by the department. and keep an eye on our website. We're in the process of listing others, but there are a number of other ways in which you can fund your education. But you need to look into this and start applying now. I often have students that get accepted into the program and then they start to look for scholarships. Don't do that. Start looking for the scholarships now and apply for the program. One of the ones that you might think about if you're an international student is the Chevening. There's the Commonwealth, the Fulbright grad, and also UCL has a number of master's bursaries, so look into those as well, particularly for UK students. There's also a scholarship finder, and you can use that. If you're coming from the United States, you do qualify for US federal funding because UCL is recognized by the US for student loans. Also, if you're in the UK, you can get a student loan. So there are lots of different funding routes. Also, if I can mention, if you're an overseas student, you can work up to 20 hours a week during term time and full-time in between terms. So there are work opportunities as well that you can take advantage of while you're studying. In terms of careers, as I mentioned, we have a lot of activities inside our department. We also have our own postgraduate career consultant who can meet with you, advise you. We have a number of our industry partners who are keen to offer internships alongside other activities with our students. We have our Health Executives and Residence program, where we have a number of senior leaders in healthcare organizations who volunteer to mentor our students, to also provide lectures. And then we have industry mentors, people who help with student projects. So the student focus is really about careers. It's about helping you ensure that you get a job. And that starts on day one. It doesn't start halfway through your program. It starts at the beginning of your program. UCL also has a fantastic career services. And again, right in Induction, they offer a series of events and ways that you can network. UCL's alumni, of course, are all over the world, topping over 300,000. So there's lots of opportunities to network. And if you're looking to start your own business or already have your own business, innovation and enterprise services are there for you. We have a hatchery, which is an incubator, and you can get lots of advice and support. So there's just so much that you can do, both in terms of the school and in terms of UCL. And some of the career destinations that you can hope to explore are, as I mentioned, health consultants. It's a big field, growing, lots of demand, and particularly for some of the specialisms on this program. So there's management roles, and again, that health ecosystem isn't just confined to national health services or organizations like the WHO. It really spans insurance companies, biotech, pharmaceutical companies, public and private healthcare organizations. And these are just a few. And then, of course, health tech and med tech, that whole startup area, prevention, diagnostics is expanding at an exponential rate. So I've talked a lot about the program, what you can anticipate, but what I haven't talked about is just how incredibly exciting UCL is. It's a fantastic university with an amazing student union. There's over 250 clubs and societies. We're located at UCL East, which is part of UCL's kind of big campus across London. It's got lots of advantages, services. It's the former Olympic Park. And so there's the aquatic center. It's great for sports, activities. There's a large kind of shopping mall nearby. And all of the services that you'll have at UCL East will be in our main building in 23-24. Fantastic facility, brand new. It'll have its own library. There's student support and well-being, advice teams, and lots of opportunities to get involved in clubs and sports, and also to volunteer, in different ways in the health sector in East London. So life in East London is really exceptional. It's a great place. It's a very affordable area, and you're not but minutes away. So if you want to jump on, the Elizabeth line and head up to the main campus, you can get there from Stratford, where UCL East is, to Tottenham Court Road in about 8 minutes. So you're right there. You can go to the main library, you can visit the student center, and then you can pop back down to UCL East. So it really is convenient. And at UCL East, there's a new student accommodation. And again, I really highly recommend that you get in there early if you're going to be joining us. These red buildings in the picture are the student accommodations. And then if you look across the river to the other side, that's the Marshgate building where the Global Business School is housed. So you can just see how convenient and how wonderful that will be. And again, lots of restaurants, really fun, really young part of London to be in and to be a student. And then lastly, London itself is an incredible city. It offers so many opportunities, lots of activities, sporting events, parks, museums. Many things are free to get into. It has been ranked by the QS rankings in 2021 as the top city for students in the UK. And it really is just one of the most incredible cities to live in the world. It's just so much fun. It's so many opportunities for you as someone studying health and management together. So that brings me to the end of my talk. I hope you've enjoyed that and found it useful. As you can see, we've got other events coming up, other open days. We've got a special session on the 11th of October, just on scholarships and information. And of course, you can always visit our website. We're really excited that you're thinking about joining us. We're here to help you. So if you've got questions, you can ask me now, but you can also always email us. We're really good at responding back. Supporting our students is really one of our focuses. And we really want to have those opportunities to engage with you and help you make this very important decision on the next step in your future. Thank you. Okay, so that's the end of my presentation. Again, I hope you enjoyed it. I would be very happy to take any questions that you might have. You can just put those in the Q&A. I'm going to be here now for the next little while. So if you want to put those in, please do. Otherwise, as I said, you can always email us, check out our website. We really want to talk to you. We want to engage with you. We want to understand your motivation, and we want to help you have a successful journey through the application process. So if there's anything about your application you're not sure of, as I said, make sure the whole application is done well. And, our applications portal will open up in October. So please do apply early. So Ashley Lowe, hello. Hi, Nora. I really enjoyed your presentation. Great. Thank you. Could I have more information on the open day tomorrow, please? Okay, so I'm not sure I know what open day you're talking about, Ashley. So if you want to just maybe the one tomorrow is for the executive MBA, and that executive MBA is a program really focused on people who have at least 7 years of management experience. So if you're thinking about doing an MBA, we have 2 MBAs. We have an in-person MBA that's offered full-time, and that is for people with about 3 years of experience or more. And then we have a mainly online MBA. It's the executive MBA, and that's for people with about 7 years of experience or more who are in work and need to do a part-time MBA. So that can only be done part-time. And once a year, they have a kind of a residential. The first year is a deep dive into the UK health system. And in the second year, it's a deep dive into another health system. The plan now is to, in the second year, to take the students to the United States. So that's a really exciting program. And if you're interested in an MBA, either online or face-to-face, but particularly if you're interested in that MBA online, that's a great event to attend tomorrow. I have another person who's written in. Good evening from Indonesia. I'm interested in both routes, the leadership and the analytics. What other factors that I need to consider to choose between those routes? Okay, so what I would think about, because they are very different routes, all three, if I can just take a minute and talk to you about those. So the finance route is really, and just also to step back for a minute, we did extensive research in determining what to have those routes on. So we went out to employers and we did focus groups and surveys. And what employers told us was the 3 areas where they needed real, upskilling, as it were, in people that they were hiring was A, leadership. They needed people who are courageous leaders, but moreover, change makers. So, understood how to get innovation, bring it forward, and embed change. So there's a lot of emphasis on that in the leadership. And also to sustain that change. One of the problems in many healthcare organizations is when they got the funding and they're doing the change, they get some change made and then they fall back. So that's a great program. You get innovation, power of politics, strategic management. There's a great course on coaching. It's not just about you getting coached, it's about how do you coach and build the best out of your people. So if you're really thinking about management and leadership, and that's the route you want to take, that's a fantastic program. The analytics is also, but that's going to give you a lot more kind of technical skills. And of course, everything around healthcare today is going to be driven by data. So that will give you an edge in terms of really being able to understand that space. It's not about turning you into a tech person per se. It's about teaching you how to, understand that aspect so that you ask the right questions as a leader, so that you can tell the story. One of the things about data is often managers lack kind of the understanding of how the numbers, where they came from, what's in the data, how to analyze the data, how to procure that data. And so that's really what you're going to get there. It will give you that edge. So one will really turn you into somebody who can, come in, make those changes, be a change maker and a shaper of healthcare. The other one will complement that, but it will really focus on a data-driven approach to really thinking about that healthcare space, understanding the analytics, the opportunity, the real data mining capabilities that are available within healthcare. So I hope that helps. And then remember, on all of these, you're going to have your core modules where you'll be mixing with people on different routes. And you'll also, when you do your projects and in your project groups, so, this is just a bite. It's a part of your program. It makes up 30% of your program. About 33 to be exact. So you'll still get human resource development, leadership. You'll get, the finance part and comparative health systems. All of that is part of your core. Okay, so the next question, how can we make our application stronger if we come from a health background rather than a business and management background? Is there any disadvantage? Absolutely not. It's really, we're looking for a diverse pool of people. We don't expect you to come in with a health background, and we don't expect you to come in with a business management background. So we will really complement that. So if you've already got a health background, that will play very well for you in this program. So I would bring that out. I would really play that as my strength in my application, as somebody who's got that health background who wants to get that business and management background. And that's why you're taking this program for. That will play very, very well. We have, by the way, a number of consultants, we have nurses, we have managers from the health sector, all of these kinds of backgrounds and people from public health coming on to this master's program. So don't hesitate to apply. All right, Polly, hi, it's really a helpful presentation. Thank you so much for the information. What's the difference between this program and UCL Health MBA? So they're very different programs, Polly, and I'm glad you asked. The MBA is a general management degree that is focused for people who already have work experience, who are looking to get a much more general business and management background, but they want it in that health context. So in the MBA, if you know much about MBAs cover lots of general areas: strategy, human resource management, marketing, economics, finance, accounting, so some other areas are slipping my mind right now. Policy and regulations, things like sustainability. So what we've done in our MBA is we build it up from the ground up. It's really designed for people who, like I said, you have to have at least 3 years of work experience. You do need to take the GMAT as well. And it will give you much more of a broad general business and management framework in which to think about health. The MSc is much more specific. You're going to get a much more focused, specific background in, your area of specialism, but also in these kind of general areas. The way they're taught is very different. The MBA is much more focused on application. So it uses a case study approach. Although you'll get some case studies in the MSc, you'll get a lot more case studies applying. It's really focused on the decision-making process that managers and leaders make. So the MBA in health really assumes that you will be going into a management and leadership role. Also on the MBA, you've got 2 different kind of capstone projects. You work on a project where you work again on a team. You're solving and working on a research project for a global health problem or challenge, but it also includes 2 weeks of field work, which is quite exciting. So you'll actually go to that country with your team and your academic supervisor or academic lead, and have a kind of a study trip to help validate the research you're working on. You'll also do a health consultancy. So the other project you'll work on is where you work with a firm. So it's much more focused on that kind of real world application. And of course you'll get some theory and that background, but it's the decision making and the application that's really emphasized in the MBA. So I hope that helps, Polly. And both are great programs, but they definitely are different and targeted different audiences. So next questions from Joy. Thank you so much for your presentation, Nora. Thank you, Joy. I have attended MBA health program last week and would like to ask, what is the main difference between the 2 programs? So that's really very close to Polly's question. I hope you can see the difference. It's really about how the mode of delivery, how they're taught, the emphasis in the MBA much more on cases, decision making. It gives you a general business and management degree with health context. This program is much more about the healthcare management space, It's everything, the theory, the way it's taught is much more about giving you that depth in health and healthcare, but it doesn't necessarily have the same emphasis on the kind of practical application in terms of the decision making and the use of cases, and also the projects are different. So they are definitely different programs, and as I said, the entry requirement is quite different. So for the MBA, you'll need 2 references. You'll need to take the GMAT. You'll also need to have, you know, a 3 years minimum work experience after your bachelor's degree, and you know, it's for a different kind of demographic and cohort. Whereas this program, you can come straight in after your bachelor's degree. You can pivot into it. You don't necessarily have to have that health background, although you'll have a focus much more on learning the theories, the practices. There won't be the extensive use of cases, although there will be some, and the projects are quite different. You've got a research project in this one that you do individually, as well as the kind of business project, but the business project is really focused on helping you learn how to write a business case and pitch. Okay. Okay, then we've got dear Professor Yilin. Hi, how are you? Dear Professor, I am a Chinese accounting student and really interested in the program because I am born in a doctor family. I have several questions. When will the application for this program open in October? I believe it will open near the beginning of October. I'm not sure of the exact date at this moment, but it'll either be in the 1st or 2nd week of October. Besides a personal statement and a reference, do I need to submit a resume? Yes, you do. Thank you so much, Yilin, for noting that. So a CV, a reference letter, and your personal statement. Does the reference letter need to show my interest in healthcare management? No, it doesn't need to show your healthcare interest in management. That will be your personal statement. But it's important that your reference understands that you're applying for a program, even if you're, say, going to do the finance route, that you're applying to the Global Business School for Health. So I would make sure I sent my personal statement and my resume CV to the person that I asked to do the reference. That way they can write you a better, stronger reference. Thank you very much for your attractive introduction. Thank you. Then we had Rehima. Hi, Nora from India. I really loved your presentation. I am already enrolled in the PG DIP Healthcare Management course and graduating next year. Can I apply for this program? So I'm not familiar with the PG DIP Healthcare Management course, but I would imagine you'd need to really, Rehima, look at the content, and you know, I think it's for you to see if how different the 2 courses are, and whether or not that's going to really add enough value for you. This is an MSc, so you know, but again, you don't want to be repeating things that you've already learned. So that would be my only caveat. If you're really interested in coming into the school and you want to do the MSc, maybe you should look to biotech and pharmaceutical management program or digital health. We have digital health and entrepreneurship as other master's degrees that are offered in the Global Business School for Health that might give you a little more spread in terms of understanding this healthcare management space. Then I have Philip. What is the cohort size per stream? Currently, we've got it at 50, and you know, we may go up, but just to let you know, Philip, the way that this is delivered, you know, we offer you, so you'll have of course, you're online, we use a flipped classroom, you'll have all sorts of learning you do, and then you'll come for 2-3 hours a week, depending on the module. And that you will always be in a small seminar, so around 25, maximum is, I believe, what we've got it set at now. So I wouldn't worry about the cohort size per stream. You'll get lots of individual attention in the Global Business School for Health. And so, I think that you will have those opportunities. I know myself, I will be teaching all of those seminars. Myself, my students get 2 hours of seminars. And again, we'll do readings, we'll have cases, we'll do some simulations. And then, of course, I also have afternoons books with guest lecturers who will talk about the topic from a practical workplace perspective. So lots to do and lots to interact, and I hope you apply. So I think, if I'm not mistaken, that's, I think I've got a couple more coming in here. How is the course delivered part-time? So that's a really good question. Currently, how does it work is if a student is taking it full-time, they can expect to be on campus 2 to 3 days a week. The reason I say 2 to 3 is they'll have to be on at least 2 days for their courses. And then the third day, on Wednesday afternoons, we have literally a huge number of career events, speakers, workshops to attend. So if you're doing it part-time, you can expect to be on campus 1 day a week. And then, of course, if you can attend some of those other events, that would be fantastic. So if you're in work, you would have to arrange with your employer to have, the time for that day that you would need to come to campus. So that's currently how our part-time works. And then Yilin, thank you very much again. Thank you. Okay, so I think that's it for questions. Again, very, very happy to, if you want to email us, something else comes up, anything going forward. I appreciate your time. I do hope you apply. It would be great to have you at the Global Business School for Health. Thank you so much. Bye.